Hi, I'm Dr. Dave Highmarsh, GP Templates. In this video, we're going to look at DVLA rules, not only because it's a good AKT question, but actually you really need to know about this for your day-to-day life and work. Because when we get it wrong, unfortunately, bad things can happen. Just highlighted here a case of, unfortunately, when a bin lorry driver didn't declare to the GP about a cardiac condition that he was under investigation, subsequently had another event behind the wheel and basically lost control of the vehicle, which then went on to kill 6 people and injuring several more. So because of this is a prime example of occupational health at its height, and so this is where the person's medical condition affected the environment, and it's just bearing in mind that the environment of being in a car adds additional stress to the person itself. So that's why this is a prime occupational health issue. Now, everything that you should revise from, I would strongly recommend that you get a copy of this, and it's the Assessing Fitness to Driver Guide for Medical Professionals. I'll leave a link of it down below. It's a massive PDF document, and it's one that I always have in my favourites at work because these issues crop up infrequently, but enough that you need to know the answer. Because often the question is, can I drive, doc? A simple yes or no. And understandably, patients think it is that binary, but as with most things in life, it's 50 shades of grey. And just remember that the DVLA is part of occupational medicine, and they have got their own doctors, and it is often the case that all you need to do as the GP is to provide the information to the DVLA, and they will then make that decision of whether they can drive or not. So I'd be very cautious about saying that someone can drive, but making sure that you know some of the relevant guidance to when they cannot drive, because a lot of it will be no, you can't drive, and you inform the DVLA. The issue with that then is time. The DVLA takes a lot of time for them to process all this information and then to make a decision. So the patients will often be angry directed to you as the GP because you are relatively easy to access, but just remember to divert them back to the DVLA. So again, sometimes it's difficult when you tell them not to drive, and a couple of lines that I often take is 1, it's illegal. 2, the one that seems to work all the time is that because I've told you not to drive, and you continue to drive, it voids your insurance. And the last one, which even though is probably the worst in terms of outcomes, doesn't seem to take much effect from what I found, is that you're at higher risk of injuring yourselves and others. So just remember there are 2 types of groups, so Group 1 and Group 2. Group 1, you're talking about your cars, your motorcycles, which generally are your smaller vehicles. And your Group 2 are your larger vehicles, not only your large good vehicles or LGVs, and also passenger carrying vehicles as well. So think buses, coaches, that sort of large ones as well. Don't forget that taxis are included in Group 2 as well, because basically you're carrying other people. Okay, so you've got more responsibility there. And so it's worth highlighting certain conditions. So think about what your brain has to do. It has to process the information, make decisions. Your eyes need to be able to see the road, not only sort of in front, but also peripherals to assess for any hazards. And also things like your heart needs to be there to make sure that all your organs are perfused. Silly things as well. Think about your blood sugars. That needs to be relatively stable so that you can maintain consciousness, and also arms, legs need to be able to control the vehicle. So we're going to take this case of you're working in the emergency department. Someone is a car driver, or they're driving a taxi, and they've had their first fit. They're currently waiting for their first fit clinic. What can you tell them? So effectively, this is the first unprovoked seizure, and because it's a taxi driver, they are Group 2, and driving must cease at least from 5 years from the date of seizure. Now, if it's an unprovoked seizure, an isolated seizure, and they're a car driver, driving must cease for 6 months from the date, or 12 months if there is an underlying causation that sort of caused this. For both Group 1 and Group 2, they must not drive and they must inform the DVLA. So the next step on, you think, well, hang on a second, they've hit over, say, that 6 months and you're seeing them again. It must be the DVLA saying that they are now fit to drive. So if someone's epileptic or having multiple unprovoked seizures, Again, it's slightly different. So for group 1, it's 12 months from the date of the most recent seizure. And then for group 2, so the larger vehicles, it's 10 years without medication. Okay, so think about that in terms of when you're doing your psychosocial history. If someone's reliant on their driving license, this can have big implications. And again, for both, must not drive, must inform the DVLA. So think about strokes, TIAs, there's some sort of elements of there. So for stroke, driving may resume 1 month after if there's been a full recovery, i.e. they've got all their limbs full power back and there's no sort of loss of visual fields, they've got no cognitive impairment and they've got no impaired limb function, but they must not drive and they may not need to inform the DVLA, assuming they've made a full recovery. That's normally where I found in terms of the letters coming back from the stroke services that they will often capture this in terms of saying, look, I'm happy that they've made a full recovery, they've passed a month, I'm happy for that to do. Okay, for group 2, a license will be refused or revoked for a year following a stroke or TIA, and again the group 2 much stricter, must not drive, must inform the DVLA, and it's up to them to make those assessments. Okay, so for TIA, so it's basically very similar sort of rules, but again, must not drive for 1 month, but need not notify the DVLA. Where more than one TIA is experienced, 1 month off driving is required following each episode. So if you have, say, 2 in quick succession, you reset the clock on the second one. And with the group 2, similar to the stroke, it's a year. Okay, and they must inform the DVLA and must not drive. So thinking about other conditions, we're not going to go into the rules, but just it's worth bearing that in mind. Thinking about, so if someone's depressed or if they got slower cognitive abilities, can they process that information? Think about Alzheimer's as well, whether it's safe for someone to drive, and there's such a spectrum of Alzheimer's and dementia that there are individual decisions and discussions to be had. Suicidal ideation, if someone's actively suicidal, they should not be driving. So think about that. If, say, you referred someone to the local emergency team, so in our case it's crisis. Drugs as well. Have you got reduced cognitive ability? So, it could be as simple as someone taking codeine, morphine, diazepam. Are they awake enough to process all the information and to make a safe amount to drive? So, I hope you're finding this useful. We are well underway in the 20% series. I've got many more videos. Go and check out the channel for those as well to help you with your AKT revision. So eyesight. So these are the minimum eyesight standards that must be hit. Okay, so at a distance of 20 meters, it's really, can you read a number plate? And they've got different criteria depending on when effectively the number plate was done. So at 20.5 meters, can you read numbers or the number plate basically at 79 millimeters high, so just shy of 8 centimeters, and 57 millimeters wide, so just shy of 6 centimeters. So that's basically your newer number plates. On your Snellen chart, it must hit 6/12 with both eyes open, or only one eye if you've only got one eye that works. And your field of vision from that side, so from your horizon, must be 120 degrees. So for group 2, it's slightly, as you would expect, slightly higher. So visual acuity of at least 6/7.5 and 6/60 in the poorer eye. Okay, so quite tight standards. And if no glasses are worn, then the corrective power needs no more than 8 diopters. That's why if you're doing a DVLA medical on the first bit, they will often have an optician report. Okay, there's no harm in getting an optician to feel that out rather than you. So heart, what does it need to do? It needs to keep beating, needs to keep everyone perfusing. So what can happen to prevent that from happening? So arrhythmias, heart attacks, also hypertension as well, thinking about the risk of strokes, as we've already covered. So angina being a sort of quite common one, it's basically, is it controlled? Okay, so if you've got uncontrolled angina, i.e. you're getting it with at rest, at motion, at driving behind the wheel, then really, you can't really drive until sort of you're getting good symptom control, but you may not need to notify the DVLA. But if you're getting similar symptoms and you're on a group 2 driver, you must inform the DVLA. And they're talking about you can be relicensed if you're getting no angina for at least 6 weeks, and they may want to do an exercise or functional test. So think about your heart attack, so your ACS. Okay, so 1 week after a PCI, or if not eligible for PCI, then it needs to be 4 weeks, and that's often they need to have an LV function greater than 40% of leaving the hospital, and with group 1 they don't need to inform the DVLA. Okay, but group 2 must stricter rules, and again it can be refused or revoked, and that it needs to be 6 weeks, assuming that they've had exercise and functional tests done, and the LV fraction is greater than 40%, and they must not drive, must inform the DVLA. So really stricter rules. Thankfully, I know certainly when I've had these patients, the cardiology service are superb and give you all this information. And it's often on the DVLA letters, they will ask who are they under in terms of their consultant, because they can pull that information from them if you haven't got it. So thinking about arrhythmias, again, this basically, if, have you got an arrhythmia that's going to mean that you're going to black out? Okay, so if you've not found an underlying cause, or the arrhythmia is controlled for at least 4 weeks, okay, you must notify the DVLA of there's likelihood of incapacitation. Okay, likewise, group 2 much stricter. They must inform them, must not drive, and must inform the DVLA. Thinking about blood sugars, okay, what do we need to do with blood sugars? So it's the obvious one that they need to be kept stable, and the risk of hypoglycemia causing a risk to having losing consciousness or having a decreased ability to make decisions. And it's worthwhile being aware of these rules. There's the guide to insulin in treated diabetes and driving. Okay, guide to drivers on insulin who are on group 2. And then likewise, thinking about the majority of our diabetic patients or with type 2 diabetes. Okay, information for drivers with diabetes treated by non-insulin medication, diet, or both. And it would be a really good quip thinking about these are all links via PDF. Again, links down below. But have you got a way to communicate these to patients? So with insulin treated diabetes, it's basically, are you hypo-aware? Okay, and making sure that you haven't had a severe episode. And what they define as severe is basically you've had someone else that's needed to help you. And you think about that, like how severe is a hypoglycemic episode that you are effectively got a reduced cognitive ability that you couldn't physically do it yourself. So it's quite severe. Practices appropriate glucose monitoring. With the rise of continuous glucose monitoring, that's brilliant. So that means that more patients will be able to monitor it. Okay, and then not regarded as a likelihood of risk of driving. So basically, patients who are suddenly taking high doses of, say, insulin, or not regular with this. Again, think about the other effects of diabetes. Is their visual acuity good? Okay, have they got good visual fields? Are they under regular eye care? Okay, the group 2 is again slightly stricter, must notify the DVLA as well with both cases, but they full awareness of the hypoglycemia, no episodes of severe hypoglycemia, and they must be practicing continuous glucose monitoring. And again, with insulin treated diabetes, the majority are all eligible for continuous glucose monitoring. So it may be that's for someone who's reluctant, but you want to get them back to driving. This may be a way to be like, well, actually, this will fulfill some of this DVLA rules. So treating diabetes with tablets, okay, it's just thinking about those medications that are risk of hypoglycemia. So just read the question and think to yourself, can this cause a hypoglycemic episode? And again, are these patients under regular review? Are they aware of the hypoglycemic episodes? Okay, and thinking about with the group 2, okay, they must notify the DVLA, but it's sort of thinking about, can they be licensed for 1, 2, or 3 years? And it's sort of no episodes of severe hypoglycemia. Are they fully aware? And okay, are they regularly monitoring? So think about your arms and legs. Just think about whether, can your arms control the vehicle? Can you do an emergency stop? I often get people who've just, say, had a fracture, and there's no sort of obvious, like if you've had X fracture, then you can't do Y for so many weeks. So I sort of basically boil it down to a bit of common sense of, can you control the vehicle in an emergency? Can you do an emergency stop? Could you steer the vehicle effectively in case someone pulls out in front of you, or say a child steps out into the road? And if the answer is no, then they're not fit to drive. Again, this is assuming they are persistently misusing alcohol, and so effectively after they have stopped drinking, they are not fit to drive for a minimum of 6 months. Okay, and they've got to have controlled drinking or abstinence and normal blood levels. So think about liver function tests. Likewise, group 2, that's pushed up to a year. With both, they must not drive and they must inform the DVLA. So think about certain drug groups. I know we've sort of briefly touched upon those that can make you drowsy, but think of more addictive ones. So your cannabis, your ecstasy, LSD, all of those ones. So again, that must be off all medication for a minimum of 6 months. Okay, we must be free of misuse and dependence, and there may be an independent medical assessment and urine screen arranged by the DVLA. So it's useful to be aware of this when you've got patients who have previously had addictions wanting to be fit to drive again. It's like, well, hang on a second, you know, it's not down to you as the GP to say, yes, you're fit, good to go. This needs to all be done by the DVLA. With group 2, so your lorries, this is bumped up to a year. So I hope that's just a very, very brief overview. We've tried to apply certain criteria to the car, okay, and thinking about what's going on and where. The document that I've sort of highlighted to you is very large, okay, but it is really, really useful to sort of aid with your revision. But I would sort of target the key conditions that I've done in this presentation just to sort of make sure you're aware of those. Again, we've got a load of other videos with the other 20% series. I hope that helps with your revision. Please leave me a comment below. Share this video around for those who are sitting their AKT soon. Very, very best luck to you.